me. I am doing part of this for a requirement for my master's in social work program to do an educational. So I've been a nursing home social worker for the last 8 years. And so what I'm going to present tonight is on that topic. And I've been in the field for like 10 years now. And my dad personally lives in the nursing home where I work. So I have also that family perspective and, you know, from the social work side. So yeah, he has MS, and so it's, you know, obviously different than ALS, but I have compassion, I guess I'm saying, for both sides of it. So I'm going to go ahead and get started, and feel free to ask me questions along the way if you would like. How do I just hit share screen? Then, okay. Let's see here. Okay.
Yep, we're seeing it.
We're seeing it. Okay, good.
Yep.
So the learning objectives are to how to select a long-term care facility, what is the cost of care, payer sources for care, what to expect, and what to bring upon move-in. And I just put a little disclaimer at the bottom because you know, between long-term care, nursing homes, elder care, there's lots of different words for this. And there can be lots of caveats. And so this is all based on my work experience in the field. So it's all been here in, you know, Omaha, Nebraska area, and between like 2 nursing facilities. So the field is ever changing, and sometimes the verbiage is ever changing. So just wanted to put that out there. I just put in a little bit more about myself, pretty much what I just told you. The first slide is how to select a long-term care facility. So first thing to know is the difference between an assisted living versus a skilled facility. So the first thing to know is that assisted livings have a nurse on staff 40 hours a week. There are CNAs that are available 24/7. They have more apartment style accommodations like studio, 1 bedroom, 2 bedroom. There are meals, housekeeping, laundry, medication management, bathing, some physical assistance, but for the most part, you still need to be able to transfer yourself, potentially even go to the restroom on your own, dress yourself. Certain places have different levels of care, but the assistance is not like full-on assistance. There is sort of a caveat with this though, with memory care, where oftentimes they'll have higher levels of care there, even though it's assisted living. So it just kind of depends on the price point for that. The skilled nursing facility is often what's called a nursing home. They are required to have a medical director, a nurse, and CNAs available 24/7. They provide a much higher level of care. So that is included but not limited to like feeding assistance, tube feeding management, modified diets, transferring residents with lifts, oxygen, catheter care, wound care, diabetic management, along with everything else that I mentioned that the assisted living would provide. So it's much more extensive. And their accommodations are more like a room style with like a half bath where it's just like the sink and toilet only in the room. And then the bathing occurs in like a community spa type area. So the cost of long-term care, assisted livings, they usually range from $3,000 to $7,000 per month. SNFs range from $7,500 to $12,000 per month. So there's a huge range in costs for this, really depending on, you know, the size, how much care is provided, what type of amenities they have. And the big thing I talk to people about, especially when they're inquiring, is about ancillaries. So sometimes there'll be extra charges beyond the daily rate. You have to also think about, like, is the cable included? Is phone included? Transportation included? Sometimes they'll charge for incontinent products. Sometimes that's included. So I always say to be aware of that. So paying for long-term care, there's three main things: Medicaid, long-term care insurance, and private pay. So basically, Medicaid is based on financial need to qualify, and then long-term care insurance, you have it now. It might be too late. I don't know a lot about long-term care insurance, but usually people have had it for many, many, many years. They're like pay into it, and then when they need it, they're able to utilize it. So what's really common is that facilities will require a certain number of months of private pay before they'll take Medicaid. Usually it's like 18 to 24 months, but that's only if they have a Medicaid accommodation available when it's needed. It's not ever a guarantee. And I always say to be leery if any place ever guarantees a Medicaid bed after a certain number of private pay months, because I've talked to countless people, families, where they're just devastated that they have to move them because they need Medicaid. They've spent down all their funds. So I commonly will tell people, if you have less than 18 months of private pay, to look for a facility that takes Medicaid right away. Because oftentimes people don't want to have to move again. They get acclimated, it becomes their home, and to uproot them it can be very devastating. So. What is needed to be evaluated for admission for long-term care? Typically it's medical information from your doctor, especially like a medication list, financial information. Sometimes there's an application, or you need to provide proof of your Medicaid. And then tours often are all virtual now, but before I used to be able to go in and actually see the facility, smell the facility, look at the care providers, see the residents. So it's a whole different world now with COVID. But oftentimes I would even go do a face-to-face visit with people in their home, or if they're at a different facility. So so what is good to decide before moving into a long-term care facility would be your physician. If you're really, I'm gonna say married to your physician, but like maybe you have a long-standing relationship with them, and you really want to keep your physician to just make sure they're okay with following you while you're in a facility, because it does change some of the communication dynamics with, they'll be reporting things to the nursing staff will be calling the doctor's office, or to see what the options are if they have like a nurse practitioner or a medical director that you could switch to, which offers a lot of convenience if that's available, so you don't have to go out for appointments. And often you can get quicker responses for things that way. Advanced directives are good to have in place too, because a lot of facilities like prefer that, just in case the resident comes to a place where they cannot make their own decisions. It's good to have that in place. And to decide whether you would want to be a do not resuscitate or a full code. Like if your heart was to stop, do you want resuscitation or do you not want resuscitation? That is something that they ask in the nursing home at admission. Here, I sort of had random things to expect. So emergency or immediate placement is often not common. So I tell people to plan ahead, and that also gives you more options. Payment, be expecting that like at admission that some sort of deposit and or first month's rent bill would be paid, or like a Medicaid share of cost. The timeline to move in is typically, I would say, about a week from the time of inquiry to actually moving in, if you wanted it to be that quick. But sometimes people will look far in advance and kind of plan it out, maybe like a month or so if that's possible. Adjustment period. I like to highlight this probably because I'm social worker side, but I noticed that a lot there's a learning curve on everyone's side, from the new resident to the family, maybe letting go of some of those care responsibilities, to the facility getting to know the person. And so sometimes things can just be a little, I would say, bumpy at first, but I always see things smooth out after we kind of all get to know each other. Everyone gets in a routine. They know who to talk to. Things really tend to get smoothed out. There's also things that are not allowed in a nursing home that sometimes family members get really like, what? You can't have this? And so things like scissors, sharp objects, things that are safety or fire hazards, knives, straight edge razors, throw rugs, aerosols, lighters, candles, wax burners. You're gonna wave now that you've interrupted my presentation. Sorry, power strips, extension cords. So also residents have the option oftentimes to keep some funds at the facility so they can have money on hand. They call it like a resident trust account. And this is to more or less discourage people from having like large sums of money in their room. Let's see. Other things to consider are that most skilled nursing facilities do offer something called post-acute rehab. So if you go to the hospital and need more intensive rehab where Medicare pays for it, then a lot of skilled facilities do offer that versus like assisted livings don't. Skilled nursing facilities are highly regulated and are surveyed annually and upon complaints. And I always like to say, with more regulation comes more rules and more restrictions. And so I find myself in a place oftentimes just having to try to explain, you know, why certain things are the way they are. It's not like we're trying to restrict residents or trying to make their lives miserable, take things away from them. It's like, these are things that we are mandated to do by our governmental like regulations. And like, if we don't follow them and enforce them, then the facility gets in trouble and fined. So other things to consider, if you go to a hospital while you're living in a long-term care facility, you'll still be charged like the daily rate, monthly rate, even while you're gone. But Medicaid does pay for residents to keep their you know, their apartment or their bed. For a skilled facility, it's 15 days, and for assisted living, that's 30 days. Another thing to consider is also that Medicaid pays for companion rooms in skilled facilities, to where like assisted livings, you have your own apartment. But that is a question I get almost on a weekly basis from inquiries is, do you provide private rooms for Medicaid recipients? And the answer is no, most places don't. Things to bring upon admission, power of attorney, paperwork, living will, health insurance cards, especially like prescription drugs, because there'll be a pharmacy that the facility will contract with, so they'll need to get all that information. Address and phone numbers of people that are allowed to have access to medical information or be points of contact for the new resident. Clothing for at least 7 to 10 days. I say that's comfortable and labeled with their name. Toiletries. Typically basic hygiene products are always provided, but like you can bring, if you have a specialty like body wash or you know, shaving cream or whatever, you can bring those things to supplement. Personal items to decorate the space, to make it feel more like home. I mean, at the facility I work at, we always encourage people to bring stuff to hang on the wall, to, you know, family photos, or just a blanket or something that's really makes you feel more at home. But also to be aware of the space and limitations, or like safety hazards. And then also, if you have any like walker or wheelchair already, durable medical equipment, CPAP machine, any of those types of things that you would already need. And then tips for moving after moving to the facility. is know your point of contact. I would say most things can be, like any issues can pretty much be eliminated with like good communication and knowing how to navigate, like who do you go to if you have a concern or question. And I say this will save you lots of time and misunderstandings. Like that's from the resident's point of view and the families. And typically it's like a social worker or some other administrative type staff person that basically knows what's going on. If you have questions about anything, knows where to find the information for you. And I always say get their email and phone number so that way you can develop a relationship with that person and ask questions. There's no dumb questions. It's part of the care team's job to answer resident family concerns, questions. So feel free to ask. Like it's not burdensome or bothersome. It's better for the resident family to know than to be guessing, and it helps build rapport with the care staff. So that is everything. I'm open to any questions or comments that you may have.
I came up with a couple of questions, but one thing I am really curious about is, and I don't know if you can speak to this or not, but just with COVID going on, I mean, you mentioned, that in-person tours aren't happening. So could you tell us what is happening or what's the process? What's the difference in the process right now?
For a tour, well, at least at the facility I'm at, we have virtual tours. So like we have one that was like pre-done kind of. It's like if you ever have, when you buy a house and you can look online and see like room to room and kind of go like that, it's a tour like that we have online. But I also will take the iPad like and just talk to the person and go like around the facility if they want to see more of like a live, almost as if they were there so they could see what it looks like.
And as far as assessments go, are you guys still able to go into homes and go through that process of like where you would be an appropriate fit for, or how does that look?
We have not. Our medical director has discouraged us from doing that. So we just do everything via phone and paperwork that we have in front of us.
Okay. We have had in the past some questions about skilled facilities versus assisted living. And, for somebody with ALS, you might be in one place today and in another place, next week. Mm-hmm. And so what is your suggestion, about picking a facility based on potential quick changes?
I would say probably go for skilled because the likelihood of having to move is less. Skilled can facilitate till end of life. So that way, if you need less assistance, that's okay. But like if you do need more assistance, then it's available when you need it.
Awesome. Does anyone else have any questions? Liz?
What does your visiting policies look like at a skilled facility right now?
Right now, we are on lockdown because we had a team member test positive. So even though none of our residents have ever gotten COVID, like knock on wood, because the team members that are coming up positive are asymptomatic and they're wearing their proper PPE. But because of that, we're mandated to basically quarantine any resident that was exposed to this person that tested positive. So every time that happens, it basically puts us back in what they call phase 1, where it's like you're shut down to everything. Residents aren't going out to appointments. There's no visitors. Everything is like through the we have window visits where people literally go up to the resident room, or we do like FaceTime or Zoom. So mostly all of our recreation team, like that's all they do pretty much all day, every day is that, because we can't have group activities. So.
Okay, thanks.
Mm-hmm.
Do you know if that's kind of the standard of what's happening at other facilities?
Yes, from what I understand. I don't know if you guys have heard like how they're testing, but basically all nursing home workers are being tested based on the positivity rate of your county. So if it's under 5%, it's once a month. If it's between 5 to 10%, then it's once a week. And if it's above 10%, which Sarpy County is now, we are going to be testing twice a week. So all of us have to be tested for COVID, like as the workers. So you don't want to talk about like strain on the staff already, but like, I don't know if any of you have had the COVID test, but it's not pleasant. And so to like, I mean, we're kind of losing staff right and left, to be honest. I mean, it's a nightmare.
Wow.
Okay, it'll be fine. Open the oven, sweetie. Sorry.
Okay.
Sorry.
Okay. Does anyone else have a question they wanted to ask? Or Liz, did you have another question?
This might be a silly question, but it's something that I guess Patty probably thinks about. One of the biggest reasons, of course, nobody wants to go into a facility right now is because of COVID. And I know that that's where my mother-in-law is. In your professional opinion, do you think that the services provided by a skilled nursing facility can also be provided by home care on some level? I mean, done well, I guess. If that question makes any sense.
Yes, yes, it can. It's just in the same way, at least what I hear in the field is the same way that we are experiencing a shortage of healthcare workers, they are as well.
Right.
So if you don't have enough people at the home care agency to fulfill what you need, you could be in, it's a hit or miss is what I'm trying to say. I hear it, there's a staffing shortage everywhere for nurses and CNAs. So I would say yes, it's possible. And I totally could agree. If it was my decision, I would stay home. I would not want to go to a facility, especially now, because you're like, I don't know when I'm going to see my loved one again. Mm-hmm. And that's so devastating and hard for people. Yeah.
Thanks.
Mm-hmm.
That is what I've heard from the community as well, is that the shortage has made home care hard to come by.
Yeah, I've even heard with Medicaid waiver that waiver is what will go into people's homes, like if you qualify for Medicaid, and they're even having problems approving hours as much as they would want to because they don't have the workers available to provide it, which is even more devastating for residents that could be at home. You know, they're in a facility now, but they could be at home, but there's not enough caregivers for them.
It's a little alarming, more than a little.
Yes.
I have a question. With skilled care, are most facilities able to handle and understand ALS care for patients, like the changes they have with their motor, and yet they still have all the sensory and cognitive skills and everything? Like I know some are more prone to helping with post-stroke, but are there certain skilled in the city and the different counties that are better known for taking care of ALS patients, the higher quality of care?
That is a really good question. And to be honest with you, I do not know the answer to that. I have been working in the same like nursing facility, like building location for 8 years, and it just switched owners basically in the middle of that. And we have never had anyone with ALS in our facility. And it's not because we wouldn't take care of them. We've not had anyone, I've never had a referral that I've looked at. And so to me, that I always thought, like before I met my practicum supervisor, who's how I met up with Emily to do this, I always thought, well, they must have really great resources to stay at home or something, or I just never really knew how come we never had ALS patients in our building before. So I don't know, maybe Emily, you could educate me on that.
I was going to say, I think Blaine can probably answer this question even better than me based on his, work history and stuff, but there are definitely facilities that are better equipped to take somebody who has ALS, and there are definitely facilities who will not take someone who has ALS because they're not equipped. I can't list them off and say who they are, but those questions are most certainly questions that you would want to ask. And sometimes it comes down to the equipment that is being used. And so for sure, if somebody has a trach, then that eliminates facilities pretty quickly.
Yep.
So a lot of times it comes down to the staff being trained, educated on the equipment that is used for someone who has ALS.
Yeah, I was gonna say, our facility, we don't take trachs oftentimes. Like the place that I know that does trachs the most is Ambassador. I don't know a lot of nursing facilities that accept trachs. Is that one of the biggest barriers, you think?
I definitely think that's one of the biggest barriers is the trach patient. So yeah, I do, for the most part, I saw a lot of them at Ambassador of Omaha. And I feel like most ALS patients and their families just step up a lot more than your average family and average patient. So I see a lot of people, most ALS patients in my experience are usually at home, but you know, I do see them at Ambassador, and there's great facilities out there that do step up and take care of trach patients. So.
And I mean, the same thing goes for home health agencies. Not all home health agencies are equipped to take care of somebody who has ALS. And they will tell you that. And that's important to talk through, you know, the decisions that you're going to make and the changes that are going to happen. And to ask those questions up front, because just like going into facility and not wanting to change, you don't want to get a home health and get comfortable and feel all good and then need to change because you've made, you know, progressed and made another decision that then they're not capable of handling.
Is a trach inevitable with ALS?
It's a personal decision, and most people don't make that decision. I mean, but some do. I mean, it happens. It's just.
Yep.
I live in a independent living facility, and we also have they have a assisted living and memory care facility, kind of all together on the campus. And I'm the only one with ALS, and they're very helpful, and like the nurse will try to help and this and that. But I know I've tried. They have like physical therapists and everything that works with people in assisted living, but they will not help me because they said they're not equipped to work with people with ALS, and they were just, you know, couldn't really. So there are limitations of stuff they can help you with.
And we have had and do have, you know, people who live in facilities who also utilize outside services, like hospice, for example, that can provide that extra level of care for people. And I'm not sure how that's working right now with, you know, those people being visitors. I don't know.
I know here they let them come in with the protective gear and assist whoever in their rooms that needs help with whatever.
Yep, and same with facilities I visited. Temperature checks are required, mask, PPE, all that good stuff as well. So.
Yeah, people are still able to get hospice services in facilities.
That's good. Great. Does anyone else have any questions? Your guys' questions have been great. Okay, well, if you want to go back and look at this, you certainly can. Just let me know. I'll send you the link to the video if you need to go back and have any questions about anything. And Vanessa, if it's okay, if anyone asks, can I share your email address for them to be able to ask questions about your presentation?
Yeah, you can give them my phone number and my email. It's totally fine. Yeah.
Great.
Awesome. Thank you so much, Vanessa. I appreciate it.
Yeah. Thank you guys. I appreciate your time.